Are officially plugged into the Overview Podcast. Overview.
From the capital, the ultimate power in the universe.
Power in the universe. Overview Radio, bringing you Overview Podcast. Up in Psychiatric Farm Hospitality, man. It's good to be home. It's good to be home, man. After a long while, So for this type of conversation that we're having today, we felt like, what? This one, we have to do it home. We have to do it home out in Psychiatric Palm Hospitality, the best hotel in town, man. Whenever you are in town, whenever you are in Gabs and you need to lodge or something, just check out Psychiatric Palm guest house on social media. There's a branch in Seruwe, there's a branch in Palape as well. Psychiatric Palm Hospitality or Psychiatric Palm guest house or Psychiatric Palm Seruwe or Psychiatric Palm Palape. It's the most beautiful place in town, man. The kitchen is there, the bar is there, the food is amazing, man. So yeah, check out Psychiatric Palm Hospitality. And before we move along, gents, remember to subscribe. Okay, help us to support this channel, man, by hitting the subscribe button. The more we grow is the more we are able to bring you such guests and such conversations, And another important thing is that it's 5 years of Overview Radio. It's 5 years of Overview Radio. In April, we'll be turning 5. Okay? And then as we move, we are nearing 200 episodes, So I think this one is going to be episode 190 something. You'll see, But we are nearing 200 episodes. Road to 200 episodes. 5 years of Over Radio and all that. But getting to the topic of the day, to the elephant of the room. Today we're gonna be talking about part of the health crisis that is going on in Botswana right now. There are a lot of I don't know if I should say pharmaceutical issues or the this and that and everything. Also, we know there's a health crisis in the country. The president always talks about it. The minister always talks about it. Social commentators as well, they always talk about it and everything. I mean, that's one of the hottest topics right now in the country. And we on this episode, we are going to be dissecting the health sector in general and more so the pharmaceutical industry in general, so that we get to understand what's going on. And to help us dish out that conversation, we are joined by someone, his bio on social media, he says he's the Phoenix entrepreneur, social commentator, Lou Wastrata. His name is none other than Joseph Khumo. Namesake.
Show leader.
Welcome to the show, my guy.
It's my
welcome
pleasure.
to the show.
It's my pleasure.
It's quite weird hosting someone that I share a name with.
Yeah.
You get it? Yeah, it's quite
Yes.
it's quite weird. Yeah, but welcome to the show, Joey.
It's a pleasure.
Can you kindly introduce yourself to Botswana Kwalapin so that they get to understand
100%.
as we get to to delve into these issues.
100%. Thank you so much, Joey, and thank you to Overview team. And let me take this opportunity to congratulate you guys on turning 5. It's not an easy thing, and I think you guys are one of the pioneers of podcasting in the country. So keep it up, keep innovating, and then we have a long way to go.
100%.
Yes, my leader, Kibidua Joseph Khumo. I'm a pharmacist by training.
Okay.
Yes, I'm an entrepreneur, and I also identify myself as a social commentator. In that, I like to join and lead the conversations that matter for people. Maybe a bit from an advocacy line, because we do need people who are able to speak up, either for or against the power for the betterment of our country. Yeah.
First things first, what is your own definition of a social commentator?
A social commentator ke ba e le gore ha di sepe se iragala in the society, in our communities, we should be able to have a conversation about it, and then we should be able to have conversations that intelligent, conversations that are meant to transform our society in a positive manner. Re sa tsose modumo hela e leng gore re bodisetsa lehatshe ko pele. Our children need role models. We need people who are able to speak in a manner that they can learn from. So that is the role that I identify as social commentation that I'm doing.
There's some sort of a negative connotation to people who are social commentators today. I think about
Yeah.
You know? Hey, you know,
Yeah.
So I don't know, how does that make you feel like when you get to see those kind of things? Because I'd like to believe that you have had one of those as well.
100%.
Yeah.
100%. I think before we talk about how does it make you feel, we have to have an understanding of why people say that. And particularly if you mix in politics, usually people will say that because they don't like what you are saying. Yes, if they don't like what you are saying, whether it's sitting with them, either challenging people that they revere, challenging people that they worship. If you are going to try and talk about false prophets, you are going to have somebody say, "Hey, I don't know to but I think for me it doesn't bother me because I never speak on topics that I don't feel confident or thoroughly knowledgeable in. That's why you haven't seen me weighing in on the issues of the Constitutional Court. Because I'm actually still reading up what does it mean? What is the implications for the country? I do have friends. I do have people that advise me in terms of my commenting. So I do take time to learn about topics that I engage in. So it doesn't bother me that somebody will say Nautolo. Actually, if anything, that might actually get me more into the topic because it's making people uncomfortable. Yes.
How would you say being a social commentator shapes your being right now? I mean, like you're an entrepreneur, you're a pharmacist, how would you say being a social commentator shapes your being in general? Does it does it have positive contributions or negative or both or whatsoever?
It's a bit of both.
Okay.
Because you can, if you're an entrepreneur, you have businesses. We do know that there are certain people that don't understand the difference between disagreeing with somebody and hating somebody. I mean, I get that a lot. You hear somebody say, "Hey, you really hate President Bog," and I'm thinking, really? Actually, I think this is one of my favorite presidents because I love his story. I love how he came through. Unlike the presidents that we've had before, he didn't come through a line of privilege or a famous surname or as far as I know, no one in his family actually was in politics or in leadership, political leadership position. So you get inspired by somebody like that, but that it doesn't mean you always agree with them.
Okay.
Yes. So you disagree because you hold a fundamentally different ideology to what that person is saying. Or even if you hold the same ideology, you might differ on how you are going about things. So it does affect me because you will understand some people might decide or we are boycotting his businesses because he or a criticizer, so that kind of thing. But it's okay because at the end of the day, I don't want my businesses to thrive if I then need to either say the positions that I don't like or I think our leaders are leading our nation into a direction or it's going to harm bana ba rona tomorrow. There is no point with me being successful now. Bana ba rona ka moso ba sala ba eme here. So I do understand the risks involved, but for me, the benefits for our country far outweighs the risk.
Yeah, so let's talk about the Lu Wastrata tag.
Yeah.
Where does it come from? What does it mean? Leader of opposition, Wastrata.
Wastrat.
Yeah, is that it?
Yeah.
Okay, okay.
Leader of opposition, Wastrat thing.
Yeah.
It wasn't planned.
Okay.
It wasn't planned. I've always held political views. I've always aired them on Facebook. But something happened after Puso and our change, where we had loads of people by law driver the propaganda the ruling party quite aggressively, and because Puso in a more honeymoon period, you can imagine a new. A new government after 58 years. People are happy. People are like really excited as we were. So it was always going to be a challenge to have to oppose. So what I saw happening was I saw loads of people feeling the need to upload, even though they upload you. The first thing is criticize, which I called a red flag, which sort of got people on me, was go promote now for me I saw that as a red flag. Yes, because they are doing a great work everywhere, but and then just that they didn't get the opportunity to see the presidential candidate at top, and then but abaya go promote you over babangwe. Now for me I saw that as a red flag, because I felt it encourages sort of bolope. It sets up a bad precedent. I need to be seen to be supporting this president for me to get somewhere. I'm not an expert in that, but for me now I would have said, okay, no sapa le gore tautona ka ba a eme a boto monela something gona le di awards tsa Botswana tse itelang di dirwa. You could have recognized them in that manner, but for you to actually just decide immediately gore kya mo promoter, obviously fast tracking review ya do tsa bone, it set as a red flag for me. So it strengthened my view ya gore no, I think everybody's uploading. This is wrong. Somebody has to stand up. And then I saw what was happening.
Provide oversight.
Provide some sort of social oversight. So I saw how the BCP was treated as an opposition. I saw how the BDP was treated as an opposition, because what they were doing was, if you raise anything wele mo BCP gate didimala wena o bitha ka gore hapane le puso. Ha o le mo BDP gate didimala wena magodu ke lona. So it was sort of getting people to not oppose the government. So the more I was opposing what the government was doing, ba bangwe es kgang ya go sota go ta go kanto wena o tsa go reng o moetele dipelo wa kganetso o le mo strategy. So I decided, actually that's a brilliant idea. So I'm actually going to spin it and build a brand that will resonate with people, because I prefer you prefer to stand for what's right. We need that, and I strongly believe I do this from a good place, from a politically neutral place, as of now. I want to join party, whether it's the UDC, the BCP or the BDP, or my favorite team in party.
As for the I mean, one of the industries that you major in is the pharmaceutical business, and like I said at the beginning of this conversation, was that we are going to be talking about the health situation, pharmaceutical situation in Botswana. Can you kindly tell us your quickly, briefly your journey
Yes, yes.
As a pharmacist.
Yes.
So that when you talk about
Yeah.
like
Yes. Yeah, the president says calls it ex cathedra. Like you see how much I like the guy. Yeah. Yes. Leader, I'm a pharmacist by training. I have masters of pharmacy from Cardiff University in the UK. Yes, in Wales. I worked. I did my internship with the government for 1 year, but unfortunately, due to the setup and the culture that I found, because I was pleased in Marina when I finished, and I just didn't like what I saw, so I quit immediately. To show you how frustrated or how much I detested the conditions of having to do work there and the leadership at the time. I quit being a pharmacist in lieu of notice. I do to quit. And at that time, that's my only job. The government.
Okay.
Yes, I left and I actually didn't have anything on the table at the time. So I was looking into selling cars and this and that. I eventually got a job in the private pharmacy, with Botswana pharmacy. So then after that, something go station, like really something to keep me afloat while I'm still pushing towards it. And then I've had a really interesting journey in the pharmaceutical industry. But in 2014, I got a job for more AstraZeneca. Yes, I think everyone knew of AstraZeneca nako COVID. Yeah. So I worked for AstraZeneca, and then I left in 2017. Yes, when I then went on to opening my own pharmacies. I started in Serowe. I've had what I can call a blessing in terms of my journey in the pharmaceutical industry.
Okay.
Because we managed to open 2 pharmacies in Serowe, and then we opened 1 in Francistown,
Okay.
2 in Muchudi, 1 in Gaborone, 1 in Palape.
Hey, man.
Yes, we then decided to sell the other ones purely because it was challenging in terms of licensing and whatnot, but also because I had good offers from my business partners. I had partnered with Botswana, so I was saying, "Hey guys, can you buy me out? I want to focus go Serowe," and then that's where we are. And then, as you mentioned earlier, I have interest in the entertainment industry. Yeah, on that journey, I've had Bridgeway back or Serowe, 422 back or Palape.
Oh, like you own 422 now?
Yeah, I did, but I gave it up now.
Okay,
yes,
okay.
and then go di Galasing, go Mahalape.
Yes,
yeah.
Yes.
Yes.
Okay.
Yeah, and
Okay.
yeah, and then I've had the Temple Lounge, more Block 9. Yes. But I think going forward, more like what I did with the pharmacies, you expand and then you find what's comfortable for you, where you want to focus on, which one you like the most, because our business way will resonate and who you are. So again, I'm going to be streaming down to Kodi Galasin le Bridgeway here.
Like so, yeah. Oh yeah, like le Bridgeway.
Yes.
Oh yeah. Oh yeah.
Yeah. One of those two.
Okay.
Yes.
Why did you quit your pharmacy job?
Yeah, with government.
Yeah.
And a number of things, leader. You see, one of the things that got me to say, you know what, this is it, was because there was always challenges. One, staffing. 2, availability ya melee. And one of the things that happened one time, I think the assistant minister came to Marina, and then there was a meeting, and then I happened to be part of the meeting. And then these guys, what they were doing, they were laying out the expectations, what they want out of particularly the pharmacy department. Like they will give you all these key performance indicators. We want you to hit this, we want you to hit that. So you have all these objectives. But what irked me the most was that I wanted to raise the challenges. Hey, we can't do what they are saying because we don't have 1, 2, and 3.
Yeah.
To start with, of our setup, staffing setup was a problem. You would have over the weekend, as an intern, an entire pharmacy department of a hospital like Marine. Yeah, and you are an intern. You home ka weekend no see. That was not only dangerous, but it was reckless. So you can't do that. You are going to overwork those interns because babasha. They are the reason why they are called interns is because they're supposed to have motona lebone lore waba ruta tiro. Right? So but the moment you have an intern pharmacist a pharmacy technician, but the thing is a pharmacy technician cannot supervise a pharmacist intern. So already there's something wrong you are doing there. Yes, and then you can't bring this up in a meeting with the leadership because you will have your boss there. Hey, when they are supposed to know what's going on the ground. So then you accept the objectives and all of these things they are expecting you to do. You don't tell them that you are not going to be able to do them because there is a problem. But to try and impress your boss, Omorare, it's okay, we'll get it done. And then he's going to tell his boss, everything is okay. So then the permanent secretary tells the minister it's okay. Then the minister tells the president all is in order. But the guys who are actually on the ground, all is not in order. Yes, you want me to take on this challenge and provide people with the right level of healthcare to the best of my training, my expertise, but you don't give me what I need to be doing. You don't give me the right tools. Yes, and the fact that you couldn't raise your voice, you couldn't express now for me, it didn't sit well with me. And because in our country, how your HOD, you are failing because you can't communicate to your boss, you pay the price. But for me, I don't know if that was the right decision at the time, but I felt I'm not going to be part of this. So I decided, I don't know, I'm going to go. Hopefully, push and then I'll come back. I'll be in a position where I bankanya deal. And but in that position because then I enjoyed being in business. But because of where I think I am now and the fact that I feel where I can speak and I'm not worried or I feel my voice is necessary to highlight the issues. Like you would have seen early last year, we raised the issues shortage of medicines. Yes, but and the government was happy to play the propaganda what we are saying is nonsense and hogwash and that kind of stuff. But I am maybe going back to point there why do I feel the need to be a social commentator? I want to make a difference that I couldn't make.
Interesting. So with that, from your professional perspective, Joey, how would you describe the current health, like the current state of Botswana's health system, especially from the from the medicine and supplies point? How would you describe that? Because listen, you are a technocrat in this field. You know, some of us are. We are entrepreneurs, we are into media, we are into all these other things, but when it comes to health, we are not technocrats there. the minister is always up in arms with the people, like there's always this back and forth.
Yeah.
You always say out and like a lot
Yeah.
of people, and also even online, a lot of people are complaining.
Yeah, 100%.
What this and that and everything,
Yeah.
and then the other guys know there's the CMS thing, there's the corruption allegations, there's just a whole lot of things going on.
Yeah.
So how would you describe the like the current health state in the country right now, from a technocrat point of view?
For lack of a better word, I think I'll call it it's a crisis.
It's a crisis.
It's a ticking time bomb. It's a crisis in that we have a situation that could have been arrested in the right manner, but was not. It was, and that is part of the problem that we have. The supply in our government system has always had challenges. Yes, it has always been sort of managed in a way that avoided us going into the crisis that we are in now. Yes, and then what happened was the change of government led to a number of fundamental errors, a catastrophic decision making. In that there was a problem. Then the previous government era a solution. In this case, the government in Nepal keep up with procurement for supply ya melemo. So they decided gore ba go ntsha the chronic medication supply from themselves, so that ba wa reka the acute tsabo flu tsabo nya. So tsabo high blood, diabetes, asthma, onoditsa ko di private pharmacies tse di ownwang ke Botswana. So these guys, what they done was they solved two problems: supply ya melemo, and then who empower the citizens. That was a great initiative under the BDP government. Yes, but a leader, Setswana sa re mashikitswa thobeng ke le phepa.
What does that mean?
Yeah, selabe se tale motsa khamelo. Yes, yes, like most solutions, they are well intentioned and perfect on their own, but the people implementing or people involved, they bring issues to that solution. So we had that solution perfect. Now I personally think it was perfect. But then what happened was, because the setup was that the government had a supply in Bamutupi. So they had their own contract. And then they got the chosen pharmacies already supply the government clients. And then the government would pay the pharmacies dispensing fees, not for melemo. So essentially we're getting melemo for free, and then I get paid for dispensing it. Yeah. So we're getting paid 45 pula per client. A very, very low fee. I mean, you even play Diadijo, most starting costs more than that. But I think because it was about Botswana, most of us felt the need to be patriotic and go along with it and support the Botswana Karon. And secondly, even though Madina Alemanyan, we understood the volume of people walking through our pharmacies. From the front shop, even though I tell her when so we were happy with that. And then what some people did more when this program was, they decided to corrupt because remember melemo we nail free of charge. Hormento do the supplier ronari razabi dispenser, and then reduce dispensing fee, right? Then Rona charge no profit whatsoever from Milimwe. And the prices were subsidized. So the government and the supplier, this is our prices. So those medicines were cheaper than Milimwe, a more private thing. So now you had pharmacists by cheaper from the government, and they supply it to their private clients with profit.
Oh yeah.
So they are happy to forego the dispensing fee, yeah, Government. So ha ke Government a mphile molemo wa say wa 500 pula, like these certain medications like ya high blood e le gore supply ya go ya kgwedi hela ke 500 pula, some even 1,000. So now motho ta ba lebella gore molemo wa hela gore ke o netswe le 1,000 pula, I can put 50%, 30% markup mo go one. I sell it more private thing for 1.5. So I make 500 pula. I don't care for the 45 pula wa Government.
Like
So
this, yeah.
yeah. So then what it did was it meant or the government was paying for melemo for stock or the farmers. So it was not trickling down to the beneficiaries, Baraba Tokam, which is government patients, Botswana ko gae,
Yeah.
ba ba sena di medical aid, right? So now the new government comes in.
So before
Yeah.
before that, in short, you're saying the private pharmacists,
Yeah,
they were corrupt in
they
this
were.
regard.
They were.
Okay.
They ruined what was a good program. They ruined something that was benefiting Botswana. Yes, for greed. It's pure human greed.
So like the private pharmacists are part of this
Yeah, they are
problem
part
that
of
we have right
they are
now.
part of the corruption that has collapsed our healthcare system. Because if they did not do that, we would not have had the new guys coming in and thinking, no, there is a problem here. Even though Lebone, they brought in the wrong solution because they didn't have a thorough understanding of where the problem was.
Yeah, like let's go on now, and then like the new government comes in.
Yeah, the new government comes in and then they realize, well, there is a leakage here.
Okay.
Yeah, but they don't know where the leakage is. But they can tell, or there is a problem. The government is spending this huge amount of money, but people are still not getting Milim. Yes. So the government, the new government terminated that agreement. They didn't even, you see, if
With
they
the
had...
private pharmacies.
Yeah, with the private pharmacies. If they had given themselves an opportunity, note that I'm deliberately saying opportunity, not giving themselves time. Because when you give yourself time when people are stealing, you are losing more money. But they could have given themselves an opportunity to communicate with pharmacies. They would have picked up where the problem was. We would have told them. But what they decided to do was, we woke up one day and then we found saving Grememo paging ya Minister of Health. Not even the nation, but pharmacy were told. Abruptly. So we had to turn people back, and at that point, the supply. Stockpiles and stockpiles of melemo. Orderly declines.
Yeah.
You can imagine, for example, my pharmacy, Ego Serwe, was helping over 2,000 patients a month.
Yeah.
So, melemo ke tsa ko suppliering beforehand so that baska ba short. So, how would terminate an agreement like that? I'm stuck le melemo ne,
Yeah.
and I can't return it to the supply.
Yeah.
So, the government also created a loophole ya gore how to terminate like that. Because I have to pay the supply. Yes. That means I'm going to sell it to the private clients. Because at that point, Government ga bue gore wa go dira gore ate go tsaya melemo ga bue gore re busetse kwa re ta compensate ya nya. They terminate gore go iragalang ke di bona kwe.
So they just terminated, and then
They
there
terminated
was
and
no
nothing.
communication after that, or like what's the plan going forward?
No.
So like ha ke go tlhaloganya sentle wa re there was a situation here.
Yeah.
Like there was corruption situation created by
Yeah.
private pharmacists.
Yes.
Right.
Yeah.
And then the new government came in, and then they
terminated.
realized the situation.
Yeah.
So in trying to stop whatever the corruption that was going on there, how they went about it, it wasn't the right way of doing it.
Absolutely. Yeah.
So and then this crisis, Re tswella e gona gona.
What happened? Ke batla go change sort of what you said.
Okay, please.
They didn't realize
Okay.
where the problem was.
Yeah.
They realized there is a problem.
There's a problem.
They didn't know where the problem was.
Yeah.
Evidently, they just realized, something doesn't make sense. Yes.
Yeah.
And then they didn't accord themselves an opportunity to find out what the problem was or where the problem was. So they would have, for example, because I don't like to speak only in terms of highlighting the problems. What they could have done, it was simple. They can still do that as part of the forensic audit. And these guys, the unfortunate thing is they are not accessible. You can try and send them letters over, hey guys, the problem is here. Can you look into this? They are not listening. They have people that they are listening to. So what they could have done, it's a simple thing. How neelwa melemo say mo kgweding ha ile gore ke na le ke tsaya melemo ya say 500,000 from the government. But remember, the government only pays me the dispensing fee. Yes. Ke tsaya melemo ya 500,000 from the supplier wa government. And then ha kgwedi hela, I'm able to pay back the 500,000. But ko ga government ke claima for batho ba le 10. Government o ntuela 450 dispensing fee.
Yeah.
There is no way my 500,000 worth of medication was dispensed to 10 people. How long it was dispensed to 10 people, I should be having a deficit. I've spent money, but I don't have the clients. Your clients are not coming to me. But what was happening was the patients you choose and then you pick up a pharmacy, that pharmacy, and then how changer you can transfer, but how yeah. So it was easy to extrapolate for a pharmacy. And then they are able to pay it back, but they don't have enough clients. So definitely this person is getting melemo and they are selling it into the private. Yes. We could have done that. They can still do that even today.
Yeah.
Do that, you will pick up problem right?
So currently,
Yeah.
now, because I was telling you this off earlier on, that
Yeah.
okay, I've been fortunate enough that
Yeah.
and fortunately people around me
Yeah.
well, like those certain situations, but you think that maybe and everything. Right now,
Yeah.
you said there's a crisis currently in
Yeah.
terms of medical supplies and the health system.
Yeah.
Melemo e teng kana ga iyo
Yeah.
right now.
Yeah.
Mo dipateleng. Because the
leader.
minister, like there was a time when minister said things were hogwash.
Yeah.
And like there was a time when
Hukuwash.
yeah, the Dubai
Yes.
thing, like
Yes.
like the Dubai
Yeah.
BDC was involved. Yeah, like
Yeah.
if I'm not mistaken.
Yes.
There was a time in what but this person melemo, what's
Yeah.
going on? Melemo e teng kana ga iyo, Mr. Khumo, as a pharmacist.
Yeah, it was a catastrophic quagmire of poor decision making.
Okay.
Because if you have a problem like it was, they came in, they realized, okay, lantana bare no, I want to issue because part of the problem here na leone, where I think leads to bad decision making is our current leadership, when they face a problem, their default setting, one, they want to minimize it, not to look like a problem. Propaganda. When that fails, they move into their next stage. Who can we blame? That's why you had the minister no, that's nonsense. I showed.
Yeah.
And then shota at some point and then just not long ago the healthcare professionals
Yes.
so that mindset when they see a problem they want to minimize it, to not make it look like a problem. When now they can no longer hide the problem, they then decide who should we blame. So that mindset ke yone e le gore has led us to where we are, because we've raised this issue for a very long time, and Babadi said we dispel as propaganda, as hogwash.
So in short, melemo ga e.
Leader melemo ga e yo gompieno, and I'm confident to say this.
Yeah.
Ke gore you had the state of public health emergency, right? It's ile hit. Irile le go helang ga yone. Both the president and the minister of health didn't see it necessary to speak to the people gore this is where we are now, state of emergency, so public health emergency se hedile, and this is what we achieved by togetse until much later on ha bona gore there is a problem, then e be le gone go disaidwa gore go neelwe feedback. And gompieno you have the minister coming up are the availability ya melemo has jumped from 17% to 60%. And you do that, you give a number like 60%, no breakdown, nothing. Melemo, there is a certain way you arrive at that, at percentages of availability.
Yeah.
In detail, gore melemo ena le different classes, right? Ke o he melemo yo reng it's easily accessible to batho gompieno.
Okay.
And I will confidently argue that it's part of the propaganda. Ya gore the government has been under pressure gore ha ba re ba bua ka constitutional court, batho ba ra ba re no, ha le kra bua ka constitutional court re na le seemo sa botsogo se sentseng ja. So they felt the need ya gore to dispel the counter argument ya botsogo, so that all the narrative can be about the constitutional court. They had to do something to catch people by get people's attention, so that people can at least for some time stop talking about the crisis ya melemo. That's why you have what the say to Milano ibuletswe batho, and then we are supposed to get excited about it now. The president has long said this State of the Union. Sorry, State of the Nation address. Sona. Yes. The Union USA. Yes. State of the Nation address. And then they've been sitting on the implementation until when they feel, okay, this issue of health, it's a disturbance on their narrative. So now they want to get it out of the way. Because they've always, the reason why there's a problem, I can ask you, the president confidently said they needed melemo 80 million for the entire year as part of announcement their state of the public health emergency. We spent north of 600 million already, Harlente, and the situation is not getting arrested. So what motivated the 80 million pula estimation?
We'll get to that.
Yeah.
I'd like us to discuss that, because I remember very well that you were even opposing the price tag, I think.
Yeah.
Back then. Okay. So what you saying situation you explain the melemo into right?
Yeah.
And then there was corruption from the private sector.
Yeah.
The pharmacist.
Yeah.
And then the Pushoebe change. These new guys came in, and then they found a situation, and then they didn't resolve it.
Yeah.
Right. So there's this thing going on right now. We inherited it, but we'll fix it.
Yeah.
This situation, did the previous government, the incumbent government, did they inherit the situation or not?
Yeah.
Or not? Was it something that was already going on? Earlier on, you mentioned, no, but okay.
Yeah.
Has it always been like this?
Yeah.
Or what?
No, it hasn't always been like this.
Yeah.
And the UDC government inherited a problem.
Yeah.
But not a crisis.
Or they inherited a problem.
Yeah.
Which is normal to inherit a problem.
Exactly. It was a problem, but they turned it into a crisis.
The crisis happened under their watch.
No, 100%. 100%, because one of the things that is to address why was the shortage of medications, addressed through Honela, the private pharmacies, the chronic medications dispensing program.
Yeah.
It was because the government of the day had failed to keep up because they were giving contracts, tenders, samilimo, to their friends, some of whom didn't even have warehouses. So
The current government?
No, the previous government.
The previous government,
Yes.
yeah.
So there was corruption.
Yeah. Okay.
So to solve it, the government came up with this program.
Yeah.
And then the corruption permeated into this new program as well. Because you didn't solve the issue of corruption or even who was corrupt.
Yeah.
So it's the same way I usually make a submission that the current government is making loads of mistakes simply because they are being advised by the guys who know how to be corrupt. So you have guys where the problem was, and then you solve the problem. But probably they are misleading the minister and then sending them into a different channel. And that channel, it's a channel of corruption. Either is benefiting and maybe the new guys are also benefiting like the previous guys, but that is neither here nor there. But the solutions we are seeing is because we are not getting the right information from the ground. Remember, the president went to Marina and then Francis, and then he is shocked.
Yeah.
How do you become shocked by a situation when not long ago you had instituted the state of public health emergency? By doing that, you should have known what the problem was. So by the time you did that, you are not fully aware of the situation on the ground. So they were trying to solve issue shortage of medicines without solving the problem system. So it doesn't matter how much the government spends, they are going to spend billions and billions and billions. We are still going to have shortage if they don't solve the system.
So system. Bear with me here. On this one.
Yeah.
Standard 7.
Yeah.
Melemo ke eng e seyo currently. Like you talk of the system. Melemo ga yo because the teman ha di rekwa gona madi. Kana melemo ga yo what? Is it because of mismanagement? Is it because of there's a flawed system going on here? Melemo ke eng e seyo right now.
Yeah. It's a combination of factors, but I'm going to highlight 3.
Okay.
The key of which is procurement.
Procurement
Yes,
system.
procurement. The way you rekwa melemo ka teng, the pharmaceutical industry.
Yeah.
It's like a mafia type of thing. For example, you have guys who have contracts, exclusivity agreements with suppliers. For example, there is certain medications or brands I can't go directly there and buy it and bring it to Botswana. Botswana, our agreement is only Joey pharmaceuticals can bring Botswana. That's the agreement, because those guys have invested, body distributors, they've invested money in marketing that brand mo Botswana. So they need a return on their investment. So when they came in, even before they terminated the pharmacy program, they terminated tenders. Somebody taking supplier ko CMS. Yes. When you do that, suppliers work on framework contracts. So listen, framework contract 5 years. So supply this and that. So how about terminate that agreement? And then you don't have a way where this person, particularly how we terminated, was the person who was holding that agreement in the country. That means that person will probably, the supplier or the manufacturer, is probably not going to want to talk to you, because the agreement they are their partner. So that was mistake number 1. What do I think the government should have done? How we tell an agreement, it's wrong, it's expensive, the price has been inflated. For the benefit of the nation, as the president, dirisa when about lausula reworks tantivas determines laws or terminate this agreement through negotiation, renegotiate this agreement. I'm taking this agreement there, which doesn't work for us because it's unfair pricing. Right, terminate, we sign a new agreement, and you want to continue. You don't want to continue, then either compensate or and remember this is to protect Sechab, so that you have access to the manufacturer anywhere that medication. Because if you don't, then you are going to do what I was opposing, more about exemption. You are going to have to order milling where registered mo Botswana. Yes, I see you are mo Botswana. Those people because or those guys but this is what's called a dossier. And then bomra bana le nako gore ba study say that dossier ba test because you send it with the samples as well. You test those ba make sure nya say dossier raise buang ke se leng teng, because whether you like it or not, the pharmaceutical industry it takes the conmen it's dintsi thata. Yes, so that has to happen. But when you make an exemption, you are fast tracking that process. Yes, when you do that at a large scale, usually that process is for special care medications like some type of an aggressive cancer. And so haro order la motho a le mongwe hela is better than at a large scale be road seller in the country, because at that point this person probably they will meet their demise if so we might as well take the risk through fast tracking this process. South Africa but we think you might die if you don't take it, so but you can't do that at a large scale, which is what happened when the president left Abaya when they could terminate the agreements. Then everybody you saw on the pictures with him is a middleman. So avoid about middlemen here. You get there, you realize that actually those guys are no, Rona, you have to come to Dubai. Our guys are based go Dubai. Dubai leader has got very little manufacturing. Go Dubai, what is a pharmaceutical middleman.
Wait, that's what Melemo Irua go Dubai.
No. Melimwene Tabunsia was coming from India and everything. Dubai is specialized at the headquarters. Yes, as agencies. They are not known for manufacturing MLM. They would rather repackage, not manufacture MLM. They are pharmaceutical manufacturing sort of pedigree.
Yes. The third thing, I think you said 1, 2, 3.
Yes.
Oh yeah, I missed it.
Boraro. Ke gore ona le challenge ya gore system ka boyone ena la ka ha e bereka ka re mo disemalo bona a bua gore melemo e gorogile mara ga e go di patients, right? It's because the system has to be followed to safeguard the patients, but also for accountability. Ga ikare melemo e goroga hela mo ya house bile e be hit a straight away ya go the patients. We can do that if we can have enough personnel to make sure gore ba khona go ira process eo ka bonako go receiver go dispatcher all of those things, right? But you are ignoring the fact that we this healthcare industry ya Botswana is understaffed. So you expect gore melemo e re ha e goroga be heta ka bonako, but you have not solved the system here. So the logistics ya thing, it's a problem. So how focus am goring ke mango wrong, which was very, very wrong and very reckless for the minister to say that, because but to buy angry lead. Imagine gompieno ke thoka haletswe ke motsadi ka gore no go ta gona molemo go sepateleng sengwe, and the minister goes on TV ara se chabare melemo e teng mathata ke babereki. You are making the nation gore banne angry towards the healthcare professionals, which is very unfair, because nna ke le pharmacist o dispenser ga se nna ke distributang ko warehousing ke make sure melemo e tswe, but wena ha o bua ga o bolelle batho gore problem e ha kae. The problem is the system, not the professionals on the ground. Yes.
Speaking of Mr. Modise, it's like there's no sense of like there's lack of cohesion between him and his tree, like his fellow healthcare workers. I mean, there was this thing with the doctors going on,
Yeah.
and now you as a pharmacist, you
Yeah.
pointing out this, and then onare,
Yeah.
and everything. Where is this lack of cohesion coming from? Because
Yeah.
you say this, the doctors say this, the minister says this. I mean,
Yeah.
as a person who's watching from the outside, I
Yeah.
the whole system now.
Yes.
Because there's lack of cohesion there.
Yeah.
What's good? Like, where does it come from?
Now, I think, like I had said before, Dr. Modise is relatively new in Botswana. He's been practicing outside. I think he came a registrar for internship, and then he's been out of the country for some time.
Okay.
So he doesn't have a thorough understanding system.
Okay.
So he could have accorded himself the opportunity ya gore a tlhaloganye system, but ha ere batho ba ba mo systeming ba ba on the ground ba le ka go bolela o bo wena o fila gore you can solve this without the input kana bo ba tsa ba gore they are enemies. Remember the doctors union ha ba bua ka issues tsa bona na go
Yeah.
what the minister decided to do ke ha ba bua gore ba plana go recruita dingaka outside. So you are trying essentially to threaten batho ba le ka gore is a problem gore nya ke tao tsa batho kon when Botswana Nurses Union, I remember early in April irile ha ba bua they had put up a picture ya a cannula tripi e tshwere ka pilisi ya sorry pampiri ya e kokometswa mo di plastic tsa di pilisi.
Yeah.
People said no, you are making things up. So, and then you had the pharmacy union saying, hey, ra sokola gona melemo. And then you had the pharmacy union ba bua gore guys 80 million is not enough. And then I think you remember when they made up the task force to carry us through the state of public health emergency. I said, it's shocking that you have this team that's meant to solve supply ya melemo, but it's led by BDC. It's almost like a constitutional review team, lawyer. So it was not but you might have the guys, well, they don't have the thorough understanding of the problem as they are, right? So he doesn't give himself and his government the opportunity for people to be open with him, to feel safe to communicate issues with him. Because once I tell you something, but you are not defensive. And Dr. Selema said something that just last week he was doing an interview on one of the private radio stations, and he said something that sort of pained me a bit, and people didn't pay attention to it. He essentially said, Rona really healthcare professionals, we have raised our voices, we've raised our concerns, we've made the issues bare. As the union, we've made the issues bare. Now it's up to the citizens to tell their government the picture on the ground. Because if I'm telling you the picture on the ground and you don't believe me, and the more I push, the more I accuse you of playing politics, the more I'm being accused of pushing propaganda. It was almost like saying, okay, in a way, and that should worry the leaders. It should worry the citizens. But if you have healthcare workers who will say, okay, challenge, but you are choosing to believe your government, and obviously because our government is very, very good with propaganda. Very good, very intelligent.
Okay.
Yes. Hey, so now these guys are essentially saying, hi, it's up to you, and that should worry every single one of us.
Let's talk about CMS now, Central Medical Stores.
Yeah.
They say, some people say, that's where the rot is.
Yeah.
I don't know that, but as a communicator in what I do and everything, I'm always neutral. I hear what you say, I hear what the other person say and everything.
Yeah.
So as a technocrat, what is Central Medical Stores king
Yes. If I had to theoretically apportion blame in terms of percentages in the country, I'll probably say or where the problem, why we are where we are. I will probably say CMS has to take between 50 and 60% of the blame.
The blame.
Yes, because the reason why the contracts these people go CMS, they colluded with their friends in terms of make sure the tender. They colluded with the politicians to make sure who influence the awarding of the tenders, even though they knew whenever by receiving these things, they know, they should have known. Someone should have been brave enough to stand up for what's right. So the CMS leader, it's a key issue in terms of the crisis. And I think you remember post the Remudisa Kila Buaka CMS Bila as in the picture motally behind prison bars, hey, and whatnot.
Yeah.
So you sort of have a general idea of where the problem is, but what are you doing about it? Yes, what are you doing about it when you decide and then you go in a way and then it shows you actually didn't understand the issue, but where we solve it.
So tiro ya CMS ke yone e leng gore melemo e rekiwa through yone.
Yes.
Ke yone e distributor melemo ga.
Ke yone distributor melemo. And you cannot you cannot try to find the issue. Yeah, our healthcare crisis without having CMS right at the top.
Who's responsible of CMS?
The Minister of Health.
It's like it goes back to Ministry of Health.
It goes back to the Ministry of Health, which is again how Botswana why batho ise ba tseilwe dikgato ba ile gore go tlile gore go sentswe go no go pushwe bile go bua ka the late former assistant minister but nobody's talking about who was his boss, his immediate boss at the time, Dr. Dikoloti. He's actually in cabinet now. So how to the rot at CMS, yeta wele part of maybe the forensic audit. From a neutral perspective, it has to make you wonder, okay, if you know where the problem is, but you decided to take the guy who was heading that ministry is in your cabinet now. Realistically, do you think the government is actually going to be willing to suffer the embarrassment of having a minister is charged for corruption? So chances of that happening, so that is why some of us realize matshelo a Botswana are put at risk, because what these guys are doing, they are more interested in looking like they are solving the problem and not actually getting to the bottom of the problem and solving it.
Yeah. Can I ask you something quickly there? Why is or was, I don't know if they're still involved, BDC involved into the purchasing of Melemo Dubai instead of CMS?
The explanation was sort of twofold. Okay. And I think they still are. It was one, the investment. No, from needed to be availed.
Okay.
And then two, I think the president and his team did not trust the guys at CMS.
Oh, okay.
Yes.
Okay.
Yeah.
Okay.
So in a way, it was a good decision to sort of have a different procuring entity, but they underestimated the impact the manufacturers and the suppliers, the contracts they have on the system.
Okay.
And also the fact that you are going to have the guys about lower they are going to be the ones distributing your name because it has to still go into the system. And again, the leakage doesn't only stop at CMS. Leader, there's people by Logore, even more at hospital levels. We know the private pharmacies and whatnot. So you have to correct the system. So you might bring in BDC to procure, and then you realize 6 months, 1 year down the line that you are actually not solving anything because you did not tackle the system.
So, okay, Melemo.
Yeah.
You mentioned that
you seem shocked by it.
No, kana go re like I'm saying, you know, gonna go teno melemo e teng, bangwe ba re ga iyo, bangwe ba re e teng, this and that and everything, you know. You mentioned earlier on gore melemo kana ga e tshwane.
Yeah.
So I'd like to I wonder gore the most affected kind of medicine or medicines ke efe. Melemo e leng gore ga iyo ka bontsi ke efe. A ja chronological diseases kana ka bo flu kana ka eng kana ka bo wa bona o di kodu like melemo e sio nke efe gore the most hard hit kind of melemo ke efe.
Yes. That's why I have issues with the minister's statement where he's saying 60% availability is at 60%.
Okay.
Because that's not communicating anything to us. We need that breakdown because the way it looks right now, we have a severe shortage of acute medications. For example, if you have an asthma attack, if you otoka go belegisiwa go spateleng o twa go ithekele dilo not only melemo but le one magare yeah mo
Botswana go ithekele dilo
go twa go tsa mo ithekela dilo
le magare
that's apelegi. That's what has been happening. That's what's happening. So more grounding. That's what we've been trying to tell people. Hey, this is what's going on. But unfortunately, like I was saying, you are met with an aggressive, an intelligent propaganda system. Kgota bo go tsewa di shelf di patela go twa di patela tsotlhe go di postang di shelf melemo e tetse gone ho. And I hope to God gore situation I think by a solver is not like what they've been doing before. Ele razon jwa ba solve situation ba act like by a solver, but leader a gona melemo mo Botswana. A gona melemo. I know gore every day go nna go supwa this needs gore melemo dispatched kwa melemo dispatched kwa it's not enough. They really need to revamp their procurement, and not only revamp the procurement but even the procurement line by bankai, because otherwise Madiala Hearts is going to go down the drain.
What are the real consequences of this shortage of medicines, like real world consequences?
Unfortunately, my leader, ke death, loss of life. Mo Batswana, you have ngwana motswana thokahala because of asthma ga se bolwetse bo tshwana ke go bola motho leader ga se bolwetse bo tshwana ke go bola motho. You have motho a nna le stroke because o ntse a sa tse melemo ya gagwe ya high blood sentle. It's unacceptable. So that is the dire consequences of situation e re mo go yone. It's loss of human life, loss of Batswana ba ile gore ga ba khone go itirela sepe because of se mo se re le mo go sone sa unemployment leader. People are suffering, and like you are saying, for most people they may not yet feel it, and but ba ile gore they interact le bone. Say for example mo Facebook, most of them are on the young side. Most of them ga ba lwale ya ka ba ba go magaeng. Most of them ba mo ga borong di clinics tsa ga borong di stokiwa faster than the clinics tsa go bosihitwa go ile gore basadi ba golo batsadi ba rona ba teng, and mosadi mogolo unfortunately ga ana account ya Facebook lead ga e go tsosa modumo ka khanya teng. So what we are seeing is the tip of the iceberg, because go bua ba le ba la mara the propaganda is able to drown out these issues, because most of banana are away because we are not yet affected. But I think it's only a matter of time. I hope and pray that it doesn't get to that level, but I think it's only a matter of time.
So as I was doing a research for this thing, you can correct me if I'm wrong. As I was doing a research, I learned that like the hidden dangers of prolonged medicine shortages, like that the public may not even be aware of. Examples of those, drug resistance, use of expired or alternative meds, black market medicines, selling counterfeit medicines and all that. Is that so? And
no, 100%.
Is that looming? Like if the situation is not fixed?
It's not only looming, leader, it's already happening.
Like it's already happening?
Yeah, it's already happening, because once you have a vacuum, there's always undesirable characters who are looking for opportunities like that, either to supply counterfeit medications because people are desperate. How it's an pharmacy, we tell over molemo talk and had to get 1,000 pull. And then somebody who are me molemo I think in alone, nka go nela ka 200 pull. Chances are you will end up buying that medication because when you need molemo. You need to live. You know you have a situation talking that medication. So that's happening, and then you also have bilingual. They are going to then take that opportunity to promote other sorts of therapies that are not tried, tested scientifically. So it's unfortunate, but it's already happening. And like you were saying, go na le medications how it's interrupt. And when you do, you raise issues tsone tsa drug resistance. Nngwe ya tsone ke gore you noted gore no ntse go na le issues tsa the shortage, even the ARVs. Leader, not long ago, Botswana, Dr. Modiso I think it was in Switzerland or something like that, where Botswana on a award who excel in terms of managing the HIV crisis. And now we are in a position where we have interruptions in the supply of those medications. There's certain regimens that are HIV management. How the virus has, for lack of a better word to make it easily understood, has learned and adapted. That's how resistance happens. So now you are going to need the next line. When you use that next line, usually it's more expensive than the line before it. So it's going to have consequences. One, two, it's going to have consequences for the government because now you're going to have to use it's more expensive than the one before. So we need to be on top of this, not to look like we are on top of. We need to be on top of it. Leader Melemogai, I'm hopeful. I am praying, as a matter of fact, but
so as a pharmacist, I mean, there has to be a body like a pharmacist, right? Yeah, like one or union. I don't know that. I don't know. Haven't you sat down with the minister?
Yeah.
To try and address the situation.
Yeah. The pharmacy union has sought audience here, the minister before. In the same manner that the doctors union have tried. But I think you would have seen their response. The minister is not available to see them. He's never available to see them. He will see everybody else, but not the guys who want to talk about the problem. So that is our biggest worry.
Is there a relationship between you, the healthcare professionals and the minister?
I wouldn't call it a relationship because I think you would have seen how usually it happens, how complain you the minister and the ministry, they usually go in a different direction, either disputing what the bodies are saying or simply ignoring it. So the relationship, whatever little of it that exists, needs to be improved. And I'm speaking from my capacity as a healthcare professional. There has to be a better relationship between the unions and the ministry. So we, for the benefit of our citizens.
Let's go back to that issue. Now, when you go the public what emergency health.
The state of public health emergency.
State of public health emergency.
Yeah.
No, apparently no 80 million.
Yeah.
Correct me if I'm wrong.
Yeah.
I stand to be corrected when it comes to the figures.
Yeah.
What the purchase here 80 million.
Yeah.
Yeah, you were opposing there.
Yeah.
Or that's impossible. Like that's an impossible figure.
Yeah.
Because the middlemen bands markup was ridiculous and everything, and so
yes,
80 million was able to purchase
Yeah.
enough supplies, and then you were like, no, educate us
Yeah.
about your opinion.
Yeah.
On what grounds was your opinion based on?
It was on the grounds that it was impossible.
Okay.
It is impossible because if I were able to purchase melemo ya 80 million ka ngwaga, then go back to the budget allocated to Ministry of Health, even under Pusha UDC, you realize there was some level of dishonesty
Okay.
in that.
Yeah.
It's simply not feasible. And we don't even need to go far, because you realize they then received almost around 200 million worth of stocks, and then there was a few donations as well. I think it was like 7 tons or something like that. And yet 4 months down the line, we are in a crisis. So if you spend north of 500 million on medicines, and then within 6 months you are in a crisis, how does that make sense that you wanted to give us the impression that 8 million was enough? So that was deliberately misleading of our people, our leadership. So that is what I opposed, because at that time they wanted people to control the narrative. They wanted people to be more mad at the previous government. Or they put price at 200 million when we can actually get it for 70 million. So again, instead of addressing the problem, our government chose it's about managing the narrative, the propaganda, which is wrong.
Yeah.
Yes. So that's why I'm saying I'm hoping and praying that our government will start to take this issue and give it the seriousness that it deserves. Because unlike the other sectors, the direct and immediate consequence of a shortage of medicines is a loss of human lives, Botswana lives.
Is the corruption still persisting, or the new government has been able to stop the corruption? Or to address it rather? Is it still persisting?
No,
Is
the
it still
corruption
there?
is still there. 100% the corruption is still there.
Even under the
the current UDC government.
Yeah, Melem.
Yeah,
It's still there.
because they've not addressed the system, and they are also bringing in questionable characters into the procurement lines. It's a melemo. So that on its own doesn't give confidence. Because we are in this industry, and we know these people.
Yeah.
We know some of them. We know they are part of the problem.
Yeah.
But you see them leading now, trying to provide a solution. And you know that particularly when there's no consequences or repercussions for but before, how do you deter the current guys from Roseng? Because so essentially it's their time to eat.
Yeah. The minister was live on national TV the other day announcing that Seki Tumile Teaching Hospital is now a public hospital.
Yeah.
How would that is that going to help the situation in anyhow? Because besides the melemo hela, the other services as well.
Yeah.
Let's say disaster or crisis as well.
Yeah.
So is the opening of Seki Tumile Teaching Hospital going to help the situation?
Yeah. Yeah, no, 100%, 100%, 150%.
Okay.
It will definitely improve the situation.
Okay.
The extent to which it does depends on the implementation. Because we don't want Seki Tumile Masire Teaching Hospital to also then inherit the problems ya marina to a point le gore ya no le yone ta bo heletsa ntse in na congested sa khone go ntsha di service. And I'm more looking into the how part, because they've spoken a lot but they haven't addressed the how part. But I think the last time the president visited Seki Tumile Masire, they did an interview, and one of the managers there, he was interviewed, the video page he was saying they are going to run a parallel system in a private le government clients. So I'm interested in finding out how that's going to work, because I'm thinking if I can go to the same facility and I can get assisted for free, why should I then opt to pay? Unless they're going to be different standards. Mo goreng ka ha go ntse ana, and maybe even the waking staff is different or something. But what would be the incentive for people to choose the paying route of Segitumila Masir, unless if they've changed, because but he only said there's a week a week ago. So I'm interested in the how part. Yes, because leader, we can make pronouncements, we can make flowery promises, but if we don't do the how, if you don't understand the how, if you don't communicate the how, because you remember after the president a bua ka sona gore Segitumila Masiri ya go simula go thusa batho, people rush to Segitumila Masiri tsana go a bua ha re simolo go ira. So maabane, they said okay with immediate effect. Yes. So but the week before go dile ta bona le two parallel systems, so those communication needs to be clear gore batho ba itse gore okay mara ha ke a kwa ke tsena ka kae gore ke mo go free ga government ke tsena ka kae gore ke ka ha go duelwang gonne clear for the nation. Yes.
Fortunately for me, I'm a very active person. I work out, I and also like by the gods, like by the grace of the Lord as well. Ha ke tshabelwe ke makwanyana or whatsoever, but rena le bagolo ko malapeng a rona and everything go re tswang teng. I have my mother ko Phalape, I have my family like my grandparents ko Molepolle hela. And le masika hela go bo motshudi ko kae na kana ke motho ke tswang gongwe.
I can see that.
So should our elders be worried? Like because of the situation that is going on? And also besides the elders as well, should we be worried? Should we be, not that we shouldn't be cautious, but should we know if shit hits the fan, we are in danger for real?
My answer is going to be short. It's going to be yes. Because the problem ka hentse ka teng ga ya address recent. So you also view more with the interest of optics. Yes, we want to be seen to be solving the problem, but are we actually solving the problem? That's my issue number one. Two, we don't see concrete plans going forward. Tsa gore go a a bit of go tshwara kwa le kwa re na le go bua ka national health insurance gore it's coming up. July last year, the president said by the end of the year, Botswana mo taba tshwere medical aid card. So in which direction are we going? So I think we should be worried in the sense that I think we have a problem, and I think the problem is not being solved in a manner that's giving us confidence. So we should be worried, and we should be asking our leaders these questions to make sure that they can actually, one, give us the right answers, and two, have the seriousness. I liked something that His Honor the Vice President Renda Bagawalati said, I think a few weeks back. He essentially said, no, we must be seen to be serious. Yes, so how about Tobalo Bona Lili serious? Then they have the confidence, what you are doing is the right thing, what you are doing has the best interest of the nation, not just optics. So yes, we should be worried, and we need to be worried until our leaders the confidence we are going somewhere.
Let's talk about the solutions and way forward now. I mean, you are always advising as a social commentator. You are always opposing and I'm advising, opposing. So now on screen now, on camera, if you are advising the government of today, if you are advising the government of today, what immediate steps would you recommend?
It's very simple, leader. And I prefer to say I critique the government, not
Yeah,
necessarily,
critique,
not necessarily oppose, because
sorry. But I get Niro opposition was okay,
yes,
critique.
yes, because the interest is not in fault finding.
Okay.
It's in making a better Botswana for all of us. And one, we need to be honest with not only the citizens,
Yeah.
but with ourselves as leaders. Because once the leadership is honest with itself, then ba tshwantse gore ba nna le that understanding of what needs to be done,
Yeah.
and identify the problems as they are. If you are honest with yourself, if you are saying people are corrupt, but you are still keeping them in offices, what does it say about you? Are you going to use the same people to solve this problem? Albert Einstein said, you cannot solve a problem with the same mindset that created it. So, really, by pele, we must make sure they will actually solve the problems, not just to sort of give this people an impression ya gore ra dissolve. So we need honesty mo boeteleding pele ba rona.
Yeah.
And then two, we need decisive action, deliberate intention ya gore we are going in this direction. If you know gore batho ba senya, tsa tshwetso, because the consequence of having motho yo senyang home o bo o dukuluga o bata all these legal things tsa gore re bata go dira, then you are going to cost the government more. O neela mothong the opportunity ya gore a ipankanye. Yes, and it's contradictory as well, because the president likes to say, na ha ke re etsela go te motho wa senya, and then we need the evidence, we need to follow mela, which is fair enough. But you look at how they treated the CEDA guys. They were accused of corruption and everything, and then action was taken pretty fast for a government that's quite slow now to act with CMS, when the minister himself said there's corruption here. Khotsere tshwetso activist anti-corruption activist a sena go khosa gore batho ba matche ba ye ko di officing tsa CEDA. The government took action, e be heletsa e suspenda boeteledi pele ba teng. So, and at that point, go buira batho ba ile gore they are not at leadership positions. Now when you have a leader, an entire minister are insinuating, and then nothing happens for this long, that is lack of decisive and intentional leadership. Three, and perhaps my most important point, ke gore the government must stop gaslighting Botswana. Understand that house a bolle batho ba maruri, it doesn't matter gore o le ka go khabisa language ya gago yang, o le ka go neela what optics, that propaganda will get found out, because house a solve the issues, whether ke unemployment, whether ke health, whether ke motho ele gore monana o le ko lapeng o eleng gore ga a bereke, monana o ko lapeng ele gore lost their mother the previous week because of shortage ya melemo. Molemi ele gore gompieno ga itse gore future ya lehatshe la rona ke eng. Di-pharmacy tse ele gore gompieno ga di duelwe ke BPOMAS, Ministry of Health le government ba palelwa ke go duela BPOMAS. Those people ga ba impressed ke the propaganda yo ka e dira. You can set up the propaganda, but ngwana yo o unemployed will not be impressed ke how good the leaders are looking, how good their content is on social media. They need results.
Yeah.
So we need to stop with the propaganda, particularly high propaganda, or it's not even leading to solutions.
Yeah.
Yeah.
I have 3 questions and then we close.
Yeah.
Does this medicinal supply crisis affect le melemo ya diphologolo? Or ke a batho hela? Or you wouldn't know since you...
No,
like, you know,
I wouldn't know the depth.
Okay.
But the most affected ke batho, because the consumption batho is way higher than ya leruo, and I think we would agree gore mo government that does not actually provide melemo e mentsi ya leruo mo diphologolong. So most people actually use private facilities for their animals, except melemo ithala go kentiwa ya dikgomo, this and that. But I haven't heard complaints from that side, even from our veterinary colleagues.
Okay.
I haven't heard them expressing that worry.
Okay, no go kile ga buiwa during like the COVID time, no go kile ga buiwa ka manufacturing our own medicines.
Yeah.
Can that be an actual solution?
Yes, it can. Yes, it can. The challenge thing, it's twofold. One, we have a very small population.
Okay.
Setting up and manufacturing is exceedingly expensive. And then there's the manufacturing, but there's also what's called the active pharmaceutical ingredient, like panado. There's the active pharmaceutical ingredient, we do the paracetamol. That ingredient, in a the rights. So unless you have melemo, you've done that, and unfortunately that's a process it takes for about 20 years to actually make a new molecule. So it's expensive, and what we can do, sort of repackage it, to be honest.
Okay.
Not necessarily manufacturing. So for you to do that, Harobo Nalidi connection in Southern Africa, we sort of export but the unfortunate thing is these guys, when they have these agreements, the manufacturers, they are based go India. You find that when they have a market like South Africa includes Botswana as part of the clientele. So Botswana is already catered for these manufacturers, almost like a province ya South Africa.
Yeah.
So now, when you go to the manufacturer now, mo Botswana, but I'm sufficiently handling Botswana from South Africa. I mean, I worked for AstraZeneca. I was reporting to Office Eko Bryanston, so you can see, obviously, they are comfortable running Botswana operatives from South Africa. And then you can say the same around. So that is the challenge. So the second thing, you will need a deliberate action by the government to say, if you manufacture, this framework contract, and the challenge either maybe it's going to be a direct appointment, or they are going to look for expression of interest for, but they are willing to take that risk. But there has to be that private-public partnership for it to happen. For someone to just come, set up manufacturing privately, very expensive, very unattractive for most investors.
Yeah. The last question, and then we close now.
Yeah.
Joey, how many currently?
Yeah.
But the traditional pharmacists.
Yeah.
Yeah. We have hosted one Dr. Nuku Malebo. Of Palape.
Yeah.
We traveled to Palape to interview her and everything.
Yeah.
And she says on for certain diseases, including some of the chronic diseases.
Yeah.
So as a pharmacist, do you have faith in traditional medicine?
Yeah.
And the second question is that can traditional medicine help? I mean, should this be a time when we take a look at the traditional pharmacist now?
Yeah.
Or herbalists.
Or herbalists, yes.
Yeah.
I think I love that question.
Yeah.
And the answer is that the right time to have taken our indigenous plants and knowledge seriously, pharmaceutically, was many years ago, decades ago. We didn't do that, but it's not too late. We can do that. The only thing that needs work is how we integrate that knowledge into modern medicine. Because there's certain vigorous processes that needs to be followed for a traditional or for any medicine to be accepted as safe for people.
Okay.
Yes, right now when you what's molemo, say for example ya ithala ile mo hadibite hale ya dipilo ya bore
Yeah.
and whatnot.
Yeah.
O ithala molemo wa teng o beile mo letsatsing for God knows for how long.
Yeah.
Right? And from the scientific knowledge, molemo ha o ba mo letsatsing, particularly mo sekupung se transparent sa cook, it denatures, it transforms the molecules tse dingwe tse di mo molemong o. So what you might end up knowing, even though that plant was safe yone go noa nako ene e extractiwa from the roots, we BDC will extract that because that's what you are doing. How BDC, you extract the chemical that you want, but then you expose it to a condition where it has not been studied. We don't know why change our name. Lo na how level high in so on halan. O kana one of the even the difference in color intensities. Obviously,
Yeah.
yes, but how quite so
Yeah.
and we have we are having loads of cases but with kidney failure and how follow it because not only do we have but we also have counterfeit and con artists they are masquerading as but was strong.
Oh yeah.
Tsone dinga tsa Setswana di thelane di apere di Air Force na re tsore ngaka Setswana tshwantse gore an anne kwa re leng teng a itsa but company you have guys ba advertising all over ba re ke ngaka Setswana and you know some of them have buiwa maru and ha sa buiwa maru means gore probably o go tala molemo e seng one o le na sa o itse wena wa o tsa health complications for you, it's not safe. So we need to find a way we can streamline melemo ya rona into the pharmaceutical industry. I mean, we have unfortunately made in China, but you know it was sourced mo Botswana.
Yeah.
So ba se tsa hasele ro ha ba tsena go ba se bankanya and then they put it through their own processes ba ba khona gore na ba se tsenye into the mainstream the pharmaceuticals. So we need to do that. And ha re dira ya lo ra go ira gone gore o pe o tabanga gane na re na ke batewa me o testiwa. Then re ka mara then once home. The same thing we are doing ka bojalwa leader. I mean bojalwa hela ba go lapeng. O tshwana ke gore government ba itse gore re tsetsa bojalwa ha ka. Yes. But how do we allow mongwe le mongwe gore a rekise molemo wa Setswana all over, something that is it should be taken more serious than bojalwa ko ga mabisi re itse re ke marago bojalwa ba marago bo bonwa bo ape o malapeng. So we need to take it seriously. We need to be bold and ambitious about making sure we can bring our indigenous knowledge into profitability and benefit for our country. Yeah.
Mr. Khumo, I just wish that, I mean, like you speak so eloquently, especially on this matter. As a citizen of the country, as a child, as a father, as a concerned citizen. I wish that people like you would be, I don't know, like would be part of the solution. And like your other colleagues that you know and everything. I just wish that there can just be some sort of a collective effort in terms of resolving what we have right now. I mean, it's not looking good when you see doctors' union fighting with the minister.
Absolutely.
The nurses' union, or other healthcare people, they were thrown under the bus. Like there's just a whole lot of chaos. So I just wish like for the benefit of the country, for the benefit of life, Botswana and citizens in general, like find a way of bridging the solution together. Any last messages to the people you know balwetsi le Batswana ka kakaretso? These were came.
Yes, leader. Really Batswana re tshwana ke gore one re rapele gore modimo anele boeteledipele ba rona lesedi le bothale ja go ba Batswana ko pele ba etelele inemena e leng gore not only mo botsogong mara le bokamoso ba le hatse ba la rona re go gongwe re tswa gakala re le sekgantshwane re mo Africa or in the world let's not drop the ball. I make sure gore re tswella re bona re le sekgantshwane, and we still have the opportunity, but re thoka gore boeteledipele ba rona bo tsepame mo goreng ra kae ba eteletse bo modimo ko pele gore re kgone go nna boammaaruri mo setšhabeng.
Yeah.
Yeah.
Ska le bala ba bridgeway le ba like le ba go digala sing le
Yeah,
ba
ba bridgeway mo se a thunya go digala sing ka. This year we are working on revamping.
Okay.
Re batla gore go thwagale Mahalape has got huge potential.
Yeah.
So you will see me placing a bit more focus on Mahalape.
Oh yeah.
This year to take it to level ya bridgeway. Yeah, because entertainment as well, it plays a huge impact on the economy.
Yeah.
So are pushing ska radio ke bo go jajana gore botagwa.
Yeah. Would you ever consider politics?
Not at the moment, but I will never say never.
Okay.
Particularly because one of the things that interests me is that people like to say, "Hey, o wa maruri o nna o bua le balance de o ska tsena mo politiking because ba ya go didimatsa ka tsela mo irileng."
Yeah.
But I think it's a wrong line of thinking.
Yeah.
Re tshwantse gore re le telle batho ba bua maruri gore ba tsene mo politiking.
Yeah.
Otherwise ra go togela ga sela lona gore le telle pele ke batho ba ile gore ga ba bua maruri.
Yeah.
So as of now, I'm not considering it, but there's still plenty of time. I'm still young. So we'll see.
Yeah. Joseph
But
Khumo.
I'm not taking offers.
Thank you so much,
Sure,
my
man.
brother. Yeah, well, like they're never taking offers. Like they always say, "Come on, I'm taking an offer that I cannot refuse."
I want to page mo Facebook kwadile stories system.
Stories is you know, I was given an offer that I cannot refuse. You know, anyway, overviewers, thank you so much, man, for spending your valuable time with us today, man. Thank you so much for subscribing. Thank you so much, man, for 5 years of watching us. You know, thank you so
beautiful.
much, man, for almost 200 episodes, you know, doing this together and everything.
Yes, ra regisana.
Ra risanya,
Yes.
ra tlana, re
Yeah.
correctana and
Absolutely.
everything and all that. So yeah, it's a very beautiful and valuable relationship that we have with you guys, that the whole of Overview Radio has with you guys, that I personally have with you guys, man. So thank you so much, man. Remember, we're shooting this episode from Psychiat Palm Hospitality, the best hotel in the country, man, the best hotel in town. And this episode is probably sponsored by Kanako Equipment, the most and the most reliable and it's a mail.
Yeah, so cool.
It's a
Ta utona wa gara
Wait.
tswedi.
The most wait, so seeking while the most reliable commercial and industrial supplier or store. Yeah, an industrial supplier or store. You know,
Yeah.
check them out. Kanago Equipment. You know, on the socials. You know, whatever that you want to buy, man. How bula barin chaka ko seroeka kwa kana mo gaps or whatsoever. Buy equipment is there. Bakery equipment, agri equipment, every kind of commercial and industrial equipment that you might be looking for. Check out Kanago Equipment on the socials. And this is how we wrap up, man. Overview podcast. Vrrr.
Yes.
Oh yeah, Kyle is at the
And he's
Yo.
actually listening.
Yo, my son
He's
is
monitoring, he's ready
engineering.
to take over.
Yeah, like my
Eh?
son Kyle is engineering today. Ramo Prima, what
Yeah,
I told you
ready to take over. 100%.
Shout out to you,
100%.
Kyle. Are you there? Overview podcast, man. Vrrr. Pa. Yeah.
Cheers.
This station is now the ultimate power in the universe.